today to really give you three pieces of information that I think are important. One is the county and the city have been tracking this, what looks to be, a severe, dramatic change in weather that will tend to arrive, according to the National Service, Thursday evening into Friday morning, that could bring us a sleet, certainly frigid temperatures, very low on the temperature scale when it comes to wind chill. And so all of that has altered some, but not all, of our testing plans. And Director Rodriguez will tell you about our altered plans for Friday so that we can prepare for safety for all our citizens, particularly on the road. However, I do want to direct your attention to items that you have probably heard about, but we would like to reinforce. And that is that at-home COVID-19 tests are now available at no cost to you at all. And this is in an effort for the federal government to increase testing nationwide. You can order them, and you can do it with this website, www.covidtest.gov or www.special.usps.com. And again, these tests are available for order. They are a rapid antigen at-home test. They can be taken anywhere. You can get results in 30 minutes. You don't even have to go to a lab. And it works whether you have COVID-19 symptoms or not. So this is an awesome opportunity for you to have COVID tests delivered to your home. And again, just to make sure, covidtest.gov or special.usps. In addition to the tests, the government is also willing to send KN95 masks to you at your home. And of course, these are the masks that help you breathe in a filtrated way, and it helps to filter the majority of the particulates of the virus. And again, it's going to be the same website. So we have these opportunities. They've certainly been announced, but we want to make sure that you know about them, and you can visit our cctexas.com website for more information, or our nuesisco.com website for more information. So with that information about free testing, free masks, and weather, we are going to turn this over to Public Health Director Rodriguez. And as always, please know that the opportunities to get information are the same opportunities to stay safe. And that is what we want for everybody, is to understand what the data is showing so that we can adjust our lives accordingly. Thank you so much, and as always, we're here to answer your questions after the press conference has concluded.
El día de hoy le quiero dar varias partes informativas, especialmente debido al cambio climático que se espera para el resto de esta semana. La directora del Distrito de Salud, Annette Rodríguez, les va a dar más información sobre lo que se espera sobre todo para las clínicas de vacunación y para las clínicas en donde se puede realizar la toma de especímenes para poder determinar si alguna persona tiene COVID-19. También les quiero indicar que los kits de prueba caseros ya están disponibles en los siguientes portales: covidtest.gov y en el otro portal es special.usps.com. Los kits caseros para poder detectar el COVID-19 son 4 por a cada domicilio, pero las personas tienen que pedirlos en línea. También el gobierno va a hacer disponibles cubrebocas N95 para las personas adultas. Estos cubrebocas van a estar disponibles en diferentes farmacias. Toda la información la puede encontrar visitando los portales stexas.com o nuecesnos.gov.
Thank you, Gabby. Annette Rodriguez, Health Director. I'm going to go ahead and start with Nueces County statistics. So I wanted to make sure everybody knew we have identified 26 now confirmed Omicron cases in Nueces County. Our first Omicron case was collected on December the 14th. Vaccines, especially boosters, continue to offer important protection. So we encourage everybody, if you've been thinking about getting vaccinated, now is still a good time for you to still get vaccinated, because we're really seeing a rise in our cases. The Omicron variant accounts for 99.9% of all new cases in the United States. And on January the 13th, we had 1,552 positive cases were confirmed here in Nueces County. That's COVID cases, so we can't tell you specifically Omicron until we send them off for genomics sequencing. And you have to remember that we only send off a very, very small sample of our positive COVID results, and so very small numbers, but we know that 99.9% of all cases in the United States are now attributed to Omicron, so it has outcompeted the Delta variant. In December of last month, 2021, we had 187 cases per day on average. So again, you see a substantial increase in the number of contagious COVID-19 that's spreading in our community. The next slide is going to show the different waves. Our first wave in July, and then our second, our beta variant wave was in the winter of last year. And then our third wave, the Delta variant, where we thought we had seen the most cases ever, almost 12,000 cases in 1 month. And now we're in the fourth wave with the Omicron variant. And it's a little disturbing, to be honest with you, because if you look at, that's through January 18th numbers, and the number of cases are 14,179. You can't even see that on the slide because the number's so big. 14,179, and the month is not over. So we believe that we're going to continue to see this surge, as Dr. Bird is going to show us here shortly with the modeling, and then hopefully our numbers will start coming down and we'll be on the other side of this wave. The age breakdown for January cases only, this is 2022, 3,676 pediatric cases. So the largest number of cases are in that age group 0 to 19. And this breakdown includes 19-year-olds, so we just sum it together as pediatric, even though we know 19s are not considered peds. From 20 to 29, almost 2,600, and then the numbers start to decrease as we go further along. So it's also protected. So we really encourages, if you're 5 years or older and you have not gotten vaccinated, you need to come in and get vaccinated to get some protection against this highly transmissible virus. The weekly cases, if you look at the last one on all the way to the right-hand side, January 10th through the 16th, 6,929 cases in 1 week. And the week prior, 5,551. So, and then if you go into December, you see we were right around 300, and then the number of deaths for January, this is actually good news, because if you look at the number of deaths for previous waves, they were really high. In the summer peak of 2020, it was 180 was the number of. So in January so far, we've had 15 deaths, but we all know that 1 death is too many. And we had a death today, a male in his 90s. He did have 2 vaccines and also had some comorbidities, diabetes and dementia, but did not have a booster. If you look at hospitalizations, it's clear that we are on that upward trend, that path COVID-19 here. And now we have 182 hospitalized patients with COVID-19, and 39 of those individuals are in the ICU. We've also seen an increase in our Driscoll Hospital hospitalizations as well. So I think the last time I looked, we were around between 10 and 15 hospitalizations for Driscoll Hospital alone. The total vaccines administered by the health district, there's other providers in our community that we're very grateful to that are still vaccinating. For the health district has been over 200 and 2,786, and very proud of what our public health staff is doing for our community. If you look at the boosters are not so great. 28,438. That's really a problem, because if you've had your 2 mRNAs, your Moderna, your Pfizer, and it's been 5 months later, it's really important that you get that booster, because that actually gives you that additional protection that you need into any of our vaccination sites, so we can get you taken care of. And it's 5 months after your second or 5 months after your first J&J. So what's the vaccination rates for Nueces County? The number is going up, so people are continuing to come in and get vaccinated, but it needs to be at a much higher rate to help with this Omicron surge. So for the total population of Nueces County, we're at 55.1% that are fully vaccinated. And then if you look at the bottom of the slide, for those 65 years and older, we're at 80.2% fully vaccinated. And then you see the other range in between. So we need to try to strive to get up to the 65 years and older vaccination rate. The positivity rate, so this is, we look at our drive-through and we look at every car that comes through on a daily basis, and then we look at everybody that tests positive, and that kind of gives us a pulse on the positivity rate. And so if you look at these positivity rates from January the 12th, 53.8%, almost 54%, and then it's running 55% currently. 55% is over 50%, so it's a very, very high rate of people that are testing positive currently through our drive-through. So our drive-through will continue testing all week from 9 to 3, except on Friday, as the judge mentioned. We are seeing that inclement weather is predicted to be here, and so we will be closed for our drive-through testing on Friday. But we will resume on Saturday at the Old Memorial Hospital from 9 to 3 p.m. Our vaccination clinics will continue. You see La Palmera, Greenwood Senior Center, Nueces County Courthouse, the Corpus Christi City Hall, the outlet malls in Robstown, the Hilltop Community Center in Annabelle. These are the places where the health department actually offers vaccines on a daily basis. What I'm going to say is to make sure that you're watching the media to see what closes, because I don't predict that the mall will close, but if the mall did close, then our staff would also be closed there and there would be no vaccination clinic. The Greenwood Senior Center, that's our only center that opens at 8 in the morning. It's 8 to 5. And so if you see City Hall closing for some reason because of the inclement weather, the Greenwood Senior Center would also close. That just means that there's too much sleet on the road, our staff can't get there, and so those types of things. If City Hall or Nueces County Courthouse is closed, we will not be there as well because we don't have keys to actually access those buildings. So pay real close attention to what's going on in the media with vaccination sites or with testing so you can know what's open and what's closed. Our outdoor COVID-19 vaccination clinics, we have the QSR Legacy on Staples, and that's Monday and Wednesdays. And then we have a Goodwill store that we're at on Air Street, and that's Tuesdays and Thursdays. And then we have FIAS parking lot on SPID, and that's Monday and Wednesdays. Next slide. So this is the school. So we're also working very closely with the schools to try to get as many kids vaccinated and trying to make it as convenient as possible for family members so they don't have to go to the mall or find one of our locations. We're coming to those schools. So, but again, if you see one of the Bluff High School, if the school is closed, we will not be there to give vaccines. If the school's open, we will be there and we will continue to vaccinate because those are later in the afternoon when we believe that the weather may start clearing a little bit. Isolation and quarantine, what's the difference? If you have COVID-19 and you test positive for COVID-19, you have to isolate. That's the bottom line. So, and you can say, I don't have symptoms, I feel fine. You have to isolate. That's the CDC guidelines, and it's 5 days. On day 6, if you haven't had fever for the last 24 hours without taking fever-reducing medication, you're able to resume normal activity on day 6 through 10, but you do have to continue to wear a mask, and it has to be properly fitting. If you were exposed, not boosted, or unvaccinated, or not up to date on your vaccines, then you must quarantine for 5 days. So who can get their booster shots? So it's anybody 12 years and older. They can actually get a third shot. It's not a booster. It's a shot for those individuals, those children that are immunocompromised. So if you have a child that struggles with being immunocompromised, has recently had some type of organ transplant, days after their second dose, and they can get their third dose. It's not a booster. It's a third dose for those individuals that are immunocompromised. So CDC just recently put out a new CDC mask guideline, and masking is a critical public health tool for preventing this spread of this virus. I think the most important part of the whole guidelines was, while they were talking about N95 mask and surgical mask and all these other things, part of it that I got out of it was that you need to find something that's comfortable for you. If it's comfortable for you, you're more likely to wear it consistently. So it needs to be comfortable for you. You have to be able to cover your nose and your mouth and your chin to be able to get the full protection. But if you're not able to tolerate it, you take it off, you're going to end up getting sick when you could just have worn a mask that's comfortable to you. It's easy to wear properly, and you will wear it more consistently. Vaccine breakthrough cases in Nueces County. We continue to see, because of the high number of positive cases in Nueces County, we continue to see many more vaccine breakthrough cases, and it's also to be expected. And so the total cases of vaccine breakthrough cases, and that means after 2 vaccines with an mRNA, Moderna or Pfizer, or after 1 J&J vaccine, we've had a total of 7,784 cases that were breakthrough cases in December 2021 through January 2022. What I am also going to say is that we are very, very far behind on contact tracing. That doesn't mean we haven't contacted them that they're positive, but we haven't been able to do all that very dramatically as well. The total hospitalized for these vaccine breakthrough cases is 280, and the total deaths is 79. So we continue to encourage you to get your vaccines. I know had those vaccines, they have some protection where you see a very small number, 280 people hospitalized, compared to those individuals that are not vaccinated or not boosted. So finally, again, pay very close attention due to inclement weather on Friday. We don't anticipate any on Thursday, but there could be as well, but mainly Friday. So pay attention to that. And if you have questions for us, you're always free to call us at the 361-826-7200, option 2. With that, it'll go to Gabby for the Spanish translation, and then I'll turn it over to Dr. Bird from Texas A&M.
Se han identificado 26 casos confirmados de Omicron en nuestra comunidad. El primer caso fue el 14 de diciembre. Las vacunas, especialmente los refuerzos, continúan ofreciendo una preventa del 99.9% de todos los casos nuevos en los Estados Unidos. El 13 de enero se confirmaron 1,552 casos positivos aquí en el condado de Nueces. Durante el mes de diciembre del 2021 se reportaron un promedio de 65 casos por día. En enero, esa cifra aumentó a 787 casos por día. En lo que va del mes, se han reportado 14,179 casos, la mayoría de personas de edades entre los 0 a los 19 años. El total, 39 de ellas en unidades de cuidados intensivos. A la fecha, se han administrado 202,786 vacunas en el condado de Nueces y 29,438 vacunas de refuerzo. Se estima que poco más del 55% de la población elegible a la vacuna la ha tomado. Las clínicas de vacunación continúan ofreciendo vacunas gratis a todas las personas que quieran vacunarse. Esta semana, varias escuelas también estarán ofreciendo vacunas para los estudiantes, pero cualquier persona adulta puede aprovechar estas clínicas. Todo dependerá del clima y si la escuela está dando clases, sobre todo el día viernes. El uso de protectores faciales son una herramienta crítica de salud pública para prevenir la propagación del COVID-19. Utilizar un cubrebocas es mucho mejor que no usar nada. Utilícela de manera constante. Asimismo, las clínicas para realizar la prueba de detección del COVID estarán abiertas, excepto el día viernes. El día viernes va a estar cerrada la clínica en el antiguo Hospital Memorial, ubicado en el 2606 de Hospital Boulevard, pero esas pruebas van a continuar el día sábado. Para cualquier otra pregunta o cualquier información, puede llamar al 826-7200.
Good evening, everybody. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Texas A&M University Corpus Christi Informatics and Modeling team. Next slide. We have 2 objectives, but primarily we're here to predict the future and tell you what's going to happen with the pandemic and address any questions you might have. Next. And on that task, we've done fairly well with this Omicron curve. So these are the most up-to-date graphics that I have. They're a few days old because we're not nearly as good at predicting changes to data formats that we receive as we are to predicting what's going to happen with Omicron. So on the cases, what you're seeing is that the number of new cases per day are tracking the prediction fairly well. I think we're in this avoid, mask, reduce transmission scenario. It doesn't look like we're going to go to the really high heights of positive cases that we could have had if nobody did anything. So that's a good thing. I know that there was a large number of cases last week, but remember that the data we're presenting, it's for the whole coastal bend, the change in data format. And we'll get out a newer graphic as soon as we can get those problems rectified. Next slide. In terms of inpatients, again, the projection is holding up very well. We haven't changed anything to the projections. The data points keep falling along here, the orange line, which is the avoid, reduce transmission and mask. If you hit next, I looked at the data and I put in the data points between there by this weekend, and we'll get that out online for everybody. But the cases and number of inpatients are continuing to follow the projection. Next. And we'll do the same thing for the ICU. It looks like it's following the red curve, but next. The latest data point is quite low, so now it looks like with the latest data, we're going more towards that orange curve and a more optimistic outlook for the number of people that are hospitalized with COVID. Now, I know a lot of people are wondering how many of those patients are in the hospital because of COVID. I don't receive that data, but I know in other locations, they've said it's something like 50% of the people in the hospital that are positive for COVID are there because of COVID. And that's the best information that I have for you right now. Next slide. Okay, so in summary, cases and hospitalizations, they're still increasing, but we're right near the peak. The peak should occur before February. The model is predicting the peak will be on the 23rd of January, but I'd say anytime in the next 7 days is most likely the peak. Hopefully we already had it last week with that huge number of cases. Next. The predicted peak cases and hospitalizations are obviously reduced by us doing something. We do have some control over what happens. And so as we face this severe weather that's coming our way, imagine if we did something, it would be warmer and not as cold. You would want to do that, right? Well, this is the same thing with COVID here. We can do something to make the outlook better, and we've been doing it, which is why the cases and hospitalizations are to it and do something as opposed to going on about our normal lives. Next slide. And something to keep in mind is that hospital vacancy is pretty low. I didn't show that slide this week, but it's very similar to the one last week. And the workers are stressed, and it's another reason that if you're looking for one to mask up and to try to avoid getting COVID, we want to give our healthcare workers a break. Next. Okay, so to combat Omicron, I know there's a lot of confusing rules out there, but I'll give you some very easy ones. One, avoid crowded areas. It's going to reduce your exposures. Next. Mask. It reduces you contracting COVID. Next. Get vaccinated. If you get infected, it reduces your chances of ending up in the hospital. Next. And if you do feel sick, isolate, get tested. And I'll make it real simple about the mask wearing and when should you isolate and all that. If you feel sick, isolate until you feel better. If you are exposed under the definition of the CDC, then isolate for 5 days. If you're out in public, wear a mask. If you do those things, you'll be in accordance with all the rules. Okay, and that's our report for this week. And we're going to go to a translation. And then the public health director will answer any questions that you might have. Thank you.
En cuanto a los pronósticos sobre la variante Omicron, existen dos predicciones. Si las personas no utilizan un cubrebocas, los casos pudieran ascender a más de 3,000. Pero el pronóstico baja significativamente con la utilización de un cubrebocas, reduciendo la transmisión. Las cifras pueden bajar hasta menos del 50%. Las hospitalizaciones también aumentan si no se toman las precauciones. Recuerde, estos pronósticos es para toda el área de la costa, no solamente para el condado de Nueces. En resumen, las hospitalizaciones continúan aumentando. Se estima que las cifras pico pueden llegar a la próxima semana. Todo depende de las decisiones que usted realice para evitar así más contagios. Evite ir, algunas de las recomendaciones que el doctor Bird da es evite ir a lugares aglomerados, tome sus precauciones sanitarias, vacúnese y aíslese si cuenta con síntomas. Hágase la prueba para estar seguro de su estatus de salud.
Thank you. Are there any questions? No? Seeing none, thank you for attending the presser, and we will see you again next week. Thank you.